My name is Lisa Thompson. Myself and Deb Palmer had put this together quite a while back, actually. I've added to it since then.
Okay.
So whoever's saying okay, can you please mute your mic? Because everybody can hear you. Please and thank you. Okay, so we decided to do it on acceptable variations, and I added in some helpful hints as well. So, because it does get confusing when the color is the same for an error. So what is an acceptable variation? Of course, it's an acceptable variation is simply defined as an allowable difference. So the acceptable variation may show up as an error on your report colored purple and green, but that is only because the computer program is not smart enough to detect an allowable difference compared to something that's correct, right? Our program is developed to show all differences between the text on the answer key and the text on the student's transcribed document. So please, can you please, I can still hear background noise. Okay, so for example, see here, it has Miralax, two different ways, but actually both of those spelled either way would be acceptable. But of course, it shows up purple and, so don't automatically think something's an error because it can be, well, it can be an error, but it can certainly be an acceptable variation as well. So the type of acceptable variations we'll be discussing today include Canadian versus US spellings, abbreviations, medications, medical words, English words, and punctuation. Now, Canadian versus US spellings. Even though US spellings is used throughout the MT-HDS course, both Canadian and US spellings are acceptable. Below are a few examples of words you may encounter throughout this course, such as color, favor, behavior, honor, center, judgment, license, defense, travel, or counseled. But, and you have to be careful about the British spelling. The only time that we would use British spelling is if Canadian spelling in Canada, we use that, spell it the same way. But there's a lot of words you have to be careful of. It's just strictly British spelling, which we don't accept, okay? More acceptable abbreviations. So D and C or D and the ampersand C. You can find these abbreviations in the reproductive system, terminology table abbreviations. However, remember per BOSS 9.4.2, do not use the ampersand under diagnosis or in an operative title. As well, in the working environment, there may be restrictions on using DNC, as some platforms do not support the use of certain symbols, such as the ampersand. It's just like you probably noticed on a couple of our answer keys that where that accent aigu, or whatever they call it, it looks like I don't know, it has a different symbol, but the reason being is because when that was switched over, that particular, on whatever platform it was used on, didn't support that particular symbol. And it's just like a lot of platforms out there, certain symbols, you don't know what they're going to look like. So that's why it is important that you don't use it in under the diagnosis heading or an operative title, because you're not sure how it's going to look. And other medical abbreviations in which the ampersand or the word and is acceptable include CNS, or H and H, H and P, I and D, O and P, and T and A. So any one of those are acceptable other than under diagnosis or operative names of operations under the operative title. Okay. So below are a few examples of acceptable abbreviations. So for example, you can spell HCG or capital HCG. So either way, we accept that. And of course, you can find both abbreviations listed in the reproductive system chapter under terminology and then table abbreviations. The most common use is the lowercase h and capital C and capital G is the most common out there. Now there's three differences, ways for weight, capital W, small t, or small lowercase w and t, like, or both capped. It is preferred to type this as WT or capital WT, but we will also accept both uppercase WT as it is listed that way in Stedman's Online. The main reason for using WT is that this abbreviation has other definitions in the medical world, such as wall thickness or wild type, as in genetics. So WT is also preferred to use if it appears like in the middle of a sentence, as opposed to at the start or whatever. So, but however, they're all acceptable. IVIG, all capped, or IVI and lowercase g. We accept both ways because you can find it in Stedman's Online. And other numerous websites online, such as emedicine.com and health.gov.nl.ca, just to list a few. And when it comes to AM and PM, do it either way. If you're going to use the lowercase, make sure you have a period after each letter, okay? If you're going to leave out the periods, then capitalize the A and M or the P and M. So either way is acceptable, but as long as you format it the way it shows there. And you can also check that out in BOSS 9.4.1. Now, milliseconds, we accept either way, the M/S or M/SEC. Both abbreviations for meters per second are acceptable per BOSS 12.1.5. Okay. Continuation of acceptable variation. C and lowercase, uppercase C, lowercase a, or both CA uppercase. And of course it stands for cancer. And there's three ways for the CA125. So you can have it either with a hyphen or a space or no space at all. It's all together, CA125 or CA space 125. And of course it stands for the cancer antigen. You can find CA hyphen 125 and CA space 125 in lab procedures tables in the oncology and reproductive chapters. And CA no space 125 can be found online at sites such as Canadian Cancer Society, as well as in some of the Stedman's reference materials. Okay, so any one of those are acceptable. Capital G, lowercase yn, or all cap GYN for gynecology. You can find these abbreviations in the reproductive system terminology table abbreviations. So in the course material. Either one is fine. Now the abbreviation DTAP, you can do DT capitalized lowercase a capitalized P, or you can capitalize just the DT, and both A and P are both lowercase. These refer to the vaccine name of diphtheria, tetanus, and pertussis. And you can refer to that in BOSS 19.2.2. Okay, so either one of those are acceptable. And the AG ratio, now you can make AG either capped or lowercase. This refers to the ratio of albumin to globulin, sorry, I can't talk, in the serum in a blood test. So both abbreviations are acceptable for that. So below are some examples of acceptable spelling, lettering of drug names. So some brand name medications are here's a tongue twister, idiosyncratic or mixed capital lettering. So per BOSS 7.3.5 and BOSS 13.2.2, it is acceptable to transcribe these drugs with initial capital only or with the correct mixed capitals, like Tricor, for example. You can either just capitalize the T, the first letter, or you can capitalize the T as well as the C. And same goes with Marilax. You can use both ways that you see here, or Fisahex, Qvar, NyQuil, any one of those that, you know, and I'm sure there's others as well, but these are kind of the most common ones that you'll probably encounter. So if you find others, say, that are in drugs.com, for example, then, you know, either way would be fine. Either capitalize just the first letter, or if it is in mixed, you can type it that way as well. So note, it is acceptable to spell the drug aspirin with either uppercase or lowercase lettering, as aspirin can either be a brand or a genetic name. So keep that in mind. Aspirin, either way, capitalized or not, doesn't matter. Both ways are acceptable because you have no way of knowing whether they prescribed the brand name aspirin or just the generic one. So, and they're both named aspirin. So medical and English word acceptable variations in spelling. There's things like brewy or brewies. So one spelt with an S and the other one without, but they're pronounced the exact same way. Okay, so often pronounced the same, either singular or plural. However, if a plural verb is dictated, then the plural spelling is required, and vice versa for the singular verb. But most cases, a lot of times they just say no brews. So in that case, you can spell it either way because you have no way of knowing if it's the plural or the singular. So once in a while, they'll dictate it in such a way that, you know, you go by the verb that's used. So you would know whether you would add the S or not, but most times you don't know. So, and calocele, that can be spelled either way with a Y or an I. That's fine. And tendinitis. Now, it's both ways are acceptable. One using the O or using the I instead of the O. Either way, it's acceptable. And same with pyriform, or you know, you can spell it with a Y or an I, whichever. Either way is fine. And same with conjoined tendon or conjoint tendon. It shows both of them in Stedman's as being acceptable. And plus, it really would be hard to tell whether they're saying it with an ED or a T at the end. So both, either way is acceptable because they mean the exact same thing. So, and gallbladder, it's acceptable one word or two words. The word spelling is the most common, however, which it is. Stedman's Online also shows that this is two words. But just remember, gallbladder is acceptable as two words, but gallstones has to be one word. Because I noticed some students spell it with two, but they shouldn't. You will be marked deducted for if you spell gallstones two words as opposed to gallbladder. So just so you know that. Disc, D-I-S-K or D-I-S-C. This is an acceptable spelling only when referring to the spine or the vertebrae. Okay, and you'll see that per BOSS 18.2.2. But the reference is to use disc when referring to all anatomy other than the eye. But when it's referring to the eye, the disc of the eye, then you must use the C, D-I-S-C. So remember that. For the eye, always use D-I-S-C. But for the vertebrae or any other disc in the bone or spine or wherever, D-I-S-K or D-I-S-C will both, either way will be acceptable, okay? Mini stroke or mini stroke with a hyphen. So one word or with a hyphen. Numerous medical sites hyphenate this term, even when not used as an adjective. So it can be like a single unit, read as a single unit with the hyphen, or you can just drop the hyphen altogether. Medical and English word acceptable variations in spelling, such as health care or healthcare, two words. Even though healthcare is the most common form, the industry is also using it as one word depending on its usage. So, but we'll accept either way, whether you want one word or two. And the same with guide pin or guide wire. We accept either way, one word or two. Stedman's medical and surgical equipment words has it both ways, and Stedman's Online also shows both spellings for guide wire as well. So, and distension, that you can spell that with a T-I-O-N or an S-I-O-N. Both ways are acceptable. Time frame, that's another one that one or two words are acceptable, either one. And bony, with an E or without an E, per Merriam-Webster dictionary that you can access online. It has it either way. So the bottom line is, if you're not sure of a spelling and you can't find it, say in a table in the course material or anything like that, just as long as you check a reputable website and you find it in there, and if you're still not sure, check a couple of websites, and if you find it that way, then it would be acceptable, okay? But they have to be reputable websites. Flat foot, with or without a hyphen. Hammer toe, it's acceptable as per Stedman's resources, either one word or two. And maneuver, we accept it. Well, it's also a British spelling, but Canada also uses the O-E, instead of just the E. So Canadians also will use the US spelling of this word at times as well. So either way for maneuver is acceptable. And follow up, the adjective. So either way is acceptable only when used as an adjective. So for example, follow-up appointment, where a noun is followed. So appointment is the noun. So you can actually use the hyphen if you want it to, or you don't have to. You can just simply use the noun. Either way, it would be acceptable. Okay. Now, here's where a lot of students get confused, the acceptable punctuation when transcribing. There are a few different ways that are acceptable for transcribing vital signs in the physical exam. And so you can have, like when it reads blood pressure 120/80, temp 36.9, pulse 78, respirations 20, all commas can be used here because there are no complete sentences. Like when you don't have a verb dictated, then it isn't a complete sentence. But having said that, you can also use periods, because even though they're not complete sentences, they're still different. They're all different. You know, temperature is totally different than blood pressure, and pulse is totally different than temp, and respirations are totally different. So, or you can say, well, this is, you can consider it a series. So either way, you can use, in this case, commas or periods will be acceptable. However, my way of thinking is, if you're ever in doubt and you're not sure, I would use a period, because regardless, for sure, if it's dictated as a full sentence, you have to use a period. There isn't a choice on that matter, because if you use a comma, then it will be considered a comma splice. So therefore, just use a period, because then it covers all bases, right? When it comes to that part there. And then that way there isn't any doubt, or you don't have to sit there and try and think and keep questioning yourself and all that stuff. But however, you can use mixed punctuation with commas and periods. So blood pressure is 120/80, period, because that's a full sentence because of the verb is. Now, temp 36.9, pulse 78, those two aren't complete sentences. So that's why you can get off with using a comma there. But now it goes on to say respirations are 20. So therefore you would put a period before respirations, because that's a complete sentence. So, and periods are required with all complete sentences. So again, now if you wanted to, you can put that whole thing using periods if you wanted to, and it would be acceptable. Or you can use the mixed punctuation. So either way, it all works. But just remember, if you are going to use commas, make sure there isn't any complete sentences in there for the vital signs. Okay. Okay. So acceptable punctuation when transcribing. So reevaluation with a hyphen or without, we accept it both ways, and you can find that in BOSS 6.5.8. Okay. And same with the anti-inflammatories. We accept with or without a hyphen. Again, BOSS 6.5.8. And that would be under prefixes in 6.5.8. Now, doctor and Ms. and junior, senior, all that sort of thing, you can type that with a period or without a period. Okay, so BOSS 6.1.1 states that it is preferred to drop the period in personal titles However, it is acceptable to use a period if you choose to. Okay, so either or, doesn't matter. See, now when way back when was in school, we were always taught you would use a period, but down, I don't know, somewhere along the line, then they decided you don't have to. So either way, it's all good. Now, when it comes to salutations, an opening salutation, it's acceptable to use either a colon or a comma, either one. And you can find that in BOSS 1.2.2. So remember that, a colon or a comma, not a semicolon, not a semicolon. That isn't acceptable. But a colon or a comma, both of those are acceptable. E. coli or E with the period coli in BOSS 9.2.2 states that it is acceptable to put a period after the genus when it is accompanied by its species. However, it is recommended by AHDI that the period be dropped, but we will accept it if you put a period after E, which is the genus, and coli, that's the species name, okay? So however way you want to do it, that's fine. Semicolon or period before however. This mixes up people sometimes. So for example, both ways are usually acceptable that way. So if she was given Tylenol, period, however, her pain did not improve, or she was given Tylenol, and you can use the semicolon here, however, her pain did not improve, because the part where it says, however, her pain did not improve is closely related to she was given Tylenol. Like they're not talking about two totally different things. If they were, then you would use a period, but for sure and not use the semicolon, but where one is closely related to the other, you can use a semicolon. Or you can still use a period. That's fine too, So either way, both acceptable. And here's too where it can get a little difficult when they say 5 and 9 12-year-old male, for example. A lot of people think, oh, geez, I'm not sure how to format that. So both of the ways you see it here, we accept. So you can do 5 and then the hyphen 9. And of course, you have to use the virgule 12, because what they're talking about is this kid is 5 years old and 9 months out of the 12 months of the year. So he's in month 9. So that's why they do that. And of course, you have to hyphenate between 12 and year and between year and old, regardless of how you do that. And it's acceptable with and just because if you're sticking to the type verbatim rule, then you would, if you're going to use the word and, you have to put a hyphen before and after the word and, okay? Now, you'll never hear them say 5-9/12 or 9 out of 12 or anything. Like they pretty well have to say 5 and 9 12-year-old. And if they say 12th as in an ordinal number, do not put the TH in there. You just 12, okay? So just miscellaneous acceptable variations. Now, cranial nerves. It is acceptable to transcribe cranial nerves using either the Arabic or the Roman numerals per BOSS 18.2.1, for example, 2 through 12. In Arabic numerals or the Roman numerals. And it also has it too in chapter 10. Has a list of Roman numerals, different things for that. And if it's, say, cancer, grade, whatever, always check your specialty chapters in your book of style, and it shows you in there too whether it should be an Arabic number or a Roman numeral. Okay. For scrub text, it is often difficult to know what text is being blanked out or scrubbed. And if you have no way of knowing what was intended, it is acceptable to use name or date. So if either one can fit in there and make sense, then we accept both ways. So, you know, if you see one or the other and it isn't obvious what it should have been, then if you're marking the report yourself, you're self-grading, don't deduct for that. We just accept it. And you'll come across as well Chem 7. Now, those are the three ways that we accept it. You can capitalize Chem and use a hyphen 7 or no hyphen, or you can use Chem 7 with a hyphen but lowercase c. So any one of those three combinations there are acceptable. And RBC or RBC lowercase, uppercase or lowercase abbreviations are acceptable, and the BOSS reference on that is 16.1.2. Minus and plus, so either typed out or symbols. It is acceptable to use either symbol or the word if you are uncertain the symbol will be easily noticed. So for clarity of its intent, you can spell it out per BOSS 9.4.2. But as a heads up, you may want to note when it comes to, and I should have put that in there, sorry. When it comes to if they're talking about a blood type, so if they say A positive, you have to write out the word positive. That is the exception to that rule. Now, if they're talking about minus and plus anything else, like a lab test or something like that, you can use either or. But when it comes to a blood type, you have to write out either positive or negative. And that's in the hematology chapter in the book of style. So just make note of that, everyone. Vitals per emer with or without a colon, so either a subheading or not, we accept it both ways. So either way is fine. Same with Lefort, with the space or without. BOSS 18.1.5 shows this as one word, but the Stedman's resources show this as two words. So we accept either one. Video duodenoscope, one word or two words. We accept both because in Stedman's and other resources, we found it both ways. So we accept either way. So now, hopefully now, when you see purple and green in your transcriptions, you will be able to differentiate between true errors and acceptable variations. As discussed throughout this webinar, not everything purple represents an error. So just remember that, everybody, because I know it's disheartening when you open that up and you see like almost a sea of purple and you think, oh my Lord, I didn't think I did that badly. Well, a lot of times you probably didn't do that badly. I'm sure a lot of it is acceptable variations, so keep that in mind. Now, some helpful hints that I thought you may like. So There's two lab tests, nitrite versus nitrate. So one with an I, one with an A. So if it's to do with urine and was found in urine or whatever, use nitrite with an I. If they're talking about a test for the heart, then use nitrate with an A. Okay. A lot of times it's confusing as well, like who versus whom. So you would use he or him in this sentence. If the answer is him, use whom. If the answer was he, then use who. So blank should I vote for. So to figure this out, you just change the sentence a little bit. So should I vote for? So then put him. Him should I vote for? That doesn't sound right at all, right? So, or, so therefore him would cancel out the word whom, because him should I vote for doesn't make sense, right? But if you say, I should vote for, oh wait, now I'm getting that mixed up. Sorry, I'm confusing everybody. Sorry. Change the sentence to, should I vote for him? So you just forget about the blank at the first and put it kind of at the end of the sentence. So ask yourself, should I vote for him or should I vote for he? Well, of course, should I vote for he doesn't make sense at all, right? So should I vote for him? That makes sense. So therefore you would use whom. So whom should I vote for? Everybody have that straight in their mind now? I'm sorry, I get all balled up myself there trying to explain it, for goodness sakes. So just remember, when it comes to trying to figure out who versus whom, just put where whom or who is placed and place it at the end, and then read the sentence. And whichever, if he makes sense, then use who. If him makes sense, then use whom. And then there's some cases that you'll run across that either one actually makes sense if you used him or he. So in those cases, they're rare, mind you, but it does happen. In those cases, then either one would be acceptable, but usually it's usually one or the other. Now, some students get a little confused on when to use the numeral 1 or when to type it out. Okay, so a good test to see if 1 should be written as a digit, so typed out, is to replace it with a single and read it back. If it makes sense, it's referring to a number rather than being used as a noun or a pronoun. So therefore you would type the numeral 1. Okay, everybody get that? So to figure out whether it should be 1 numeral or written out, read it back in the sentence, but where it says 1, say a single. And if it makes sense, then it's the numeral 1, and you would type out the numeral. Okay. And of course, this one here, a lot of times students get a little confused on when to capitalize and when not to capitalize a department. So if read it back to yourself and the sentence will still make sense grammatically, then the specialty name is being used as a proper noun and you capitalize it. Exceptions to this rule would be if it ends in center or clinic or service, department or room, then it's normally not a proper noun unless it's the name of a business. So, for example, he will be referred to orthopedics. So he will be referred to Dr. Smith. Makes sense. So capitalize orthopedics. Okay, so basically what you would do is swap it out, swap the department out with Dr. Smith, and if it makes sense, then capitalize. If it doesn't, don't capitalize. But you never usually would capitalize a service or a center or a clinic unless the name of that center or clinic is dictated. It has to be specific. Okay. So, and follow up is another source of confusion. So try substituting the word eat, and if the sentence still makes, then use the two-word form, the verb. So the patient will follow up next week. The two-word form is correct because the patient will eat next week. It makes sense. Or the patient has a follow-up appointment scheduled. The one-word form is correct because the patient has an eat appointment, or I should have that incorrect, sorry. An eat appointment scheduled does not make sense. So, and many times word follow-up, so it'll precede the verb form. Let me just, oh, I'll have to change that after. Anyway, ignore that. I will have that changed, and as well, I'm going to make this into a PDF document as well that you'll be able to, once the form's up and running, you'll be able to download it so you can refer to this, so you don't have to try to memorize and all this stuff. Okay. To versus to, so TO versus TOO are homophones that often confuse people. To, TO, is used to show motion. Example, I'm going to the shop. And to means also or extremely. Example, I would like to come to, but I'm too tired. So if you swap that out, like I would like to come also, but I'm extremely tired. So see, you can swap the word TOO, both of them, out with also and extremely, and it makes sense. Right? So that's how you would know that it would be TOO. I versus me, that's another one that is confusing. So, for example, send the copy of the book to Jane and would it be I or would it be me? So to figure out if you should use I or me, change the sentence by dropping the word Jane to see which word makes sense. So send the copy of the book to I. No, doesn't make sense. Send the copy of the book to me. Well, that makes sense. So the answer is me. So anytime you come across that, just say the sentence again, but leave out the first person that they're referring to. And then you'll be able to easily, and it's so simple once you realize that. Hyphenate. All compound modifiers when they precede and modify noun or pronoun. Example, the patient had a moderate size hiatal hernia. Please mute yourself, whoever just unmuted themselves, please. That would be hyphenated because you have hiatal hernia, which is a noun. So it's modifying that. And sometimes to figure it out, for example, deep dermal interrupted sutures, you wouldn't hyphenate because they're not saying the dermal interrupted sutures are deep. It is not saying that the interrupted, our sutures are deep dermal. So therefore, you know, it just makes sense to just leave it the way it is, deep dermal interrupted sutures, because that's what they're saying. The dermal interrupted sutures are deep. It isn't saying that the interrupted sutures are deep dermal. So sometimes you have to kind of change it around like that just to see if it makes sense or not. Another easy thing to think about here for hyphens is do not use a hyphen in a compound modifier to link an adverb ending in ly. So example, she complained of moderately acute pain. You wouldn't hyphenate moderately and acute. So if you see an ly, you don't even have to worry or think about it. It will not be hyphenated. Do not hyphenate compound modifiers if the unit of measure is an abbreviated metric unit. So example, 2 centimeter mass, you would never hyphenate 2 and cm per centimeter. Never hyphenate not metric units of measure. Never do that. You can, however, hyphenate non-metric units of measure if there's a noun that follows after that. But like 1 inch incision, for example. So if post is used, like a lot of times you can get confused between whether post operative, for example, is a 1 word or 2 words or whatever. So if post is used as an adjective, it will be transcribed as 1 word. So for example, post-operative diagnosis, and this coincides with the BOSS 6.5.8 as well, not to use a hyphen. And if post is not used as an adjective, it will be a separate word altogether. Like she will be seen post-surgery, for example. And I think that is all. So this concludes today's webinar, and I hope the information that was presented today makes your life a little less stressful when viewing your reports as well as transcribing them.